Main signs of heat stroke in kids. Heat stroke is the most severe heat-related illness. It occurs when the body cannot control its temperature. The body's temperature rises rapidly, the sweating mechanism fails, and the body is unable to cool down. When heat stroke occurs, the body temperature can rise to 106 degrees Fahrenheit or higher within 10 to 15 minutes. Heat stroke requires emergency treatment. Untreated heat stroke in babies can quickly damage the brain, heart, kidneys, and muscles. The damage worsens the longer treatment is delayed, increasing babies' risk of serious complications or death. Welcome to our YouTube channel. We bring to you interesting topics about babies, and we provide lucid explanation on topics that relates with babies. And today, we will be talking about an important and interesting topic: main signs of heat stroke in kids. Heat stroke is the most serious heat-related illness. It occurs when the body becomes unable to control its temperature. The body's temperature rises rapidly, the sweating mechanism fails, and the body is unable to cool down. Body temperature may rise to 106 degrees Fahrenheit or higher within 10 to 15 minutes. Heat stroke can cause death or permanent disability if emergency treatment is not provided. Those at greatest risk for heat-related illness include infants and children up to 4 years of age, people 65 years of age and older, people who are overweight, and people who are ill or on certain medications. However, the scope of this video will bother on the main signs of heat stroke in kids. Heat stroke results in more than 600 deaths a year in the United States. Rates have increased between 1995 and 2015. Purely exercise-induced heat stroke, though a medical emergency, tends to be self-limiting and fewer than 5% of cases are fatal. Non-exertional heat stroke is a much greater danger. Even the healthiest person, if left in a heat stroke-inducing environment without medical attention, will continue to deteriorate to the point of death, and 65% of the most severe cases are fatal even with treatment. The cause of heat stroke in kids include exposure to a hot environment. In a type of heat stroke called non-exertional, classic heat stroke, being in a hot environment leads to a rise in core body temperature. This type of heat stroke typically occurs after exposure to hot, humid weather, especially for prolonged periods. Strenuous activity. Exertional heat stroke is caused by an increase in core body temperature brought on by intense physical activity in hot weather. Anyone exercising or working in hot weather can get exertional heat stroke, but it's most likely to occur if you're not used to high temperatures. In either type of heat stroke, your condition can be brought on by wearing excess clothing for kids can prevent sweat from evaporating easily and cooling kids' body, and this can lead to heat stroke in babies. This is one of the major reasons proper ventilation for kids is advised. Becoming dehydrated by not drinking enough water to replenish fluids lost through sweating. Heat stroke can result in a number of complications, depending on how long the body temperature is high. Severe complications include vital organ damage. Without a quick response to lower body temperature, heat stroke can cause baby's brain or other vital organs to swell, possibly resulting in permanent damage. Death. Without prompt and adequate treatment, heat stroke can be fatal. Heat stroke is predictable and preventable, especially in babies. Take these steps to prevent heat stroke during hot weather. Wrap your kid with lightweight clothing. Wearing excess clothing or clothing that fits tightly won't allow baby's body to cool properly. Protect your kid against sunburn. Sunburn affects body's ability to cool itself, so protect baby outdoors. Give your kid plenty of fluids. Staying hydrated will help your baby's body sweat and maintain a normal body temperature. Take extra precautions with certain medications. Be on the lookout for heat-related problems if you give baby medications that can affect body's ability to stay hydrated and dissipate heat. Never leaving your kid in a parked car. This is a common cause of heat-related deaths in kids. When parked in the sun, the temperature in the car can rise 20 degrees Fahrenheit, more than 11 degrees Celsius, in 10 minutes. It's not safe to leave babies in a parked car in warm or hot weather, even if the windows are cracked or the car is in shade. When your car is parked, keep it locked to prevent a child from getting inside. Get your kid acclimated. Limit time spent working or exercising in heat until you're conditioned to it. People who are not used to hot weather are especially susceptible to heat-related illness. It can take several weeks for your body to adjust to hot weather. Be cautious if kid is at increased risk. If your kid take medications or have a condition that increases his risk of heat-related problems, avoid the heat and act quickly if you notice symptoms of overheating. If your kid participate in a strenuous sporting event or activity in hot weather, make sure there are medical services available in case of a heat emergency. Heat stroke signs in kids include high body temperature. A core body temperature of 104 degrees Fahrenheit, 40 degrees Celsius, or higher, obtained with a rectal thermometer, is the main sign of heat stroke. Altered mental state or behavior, confusion, agitation, slurred speech, irritability, delirium, seizures, and coma can all result from heat stroke. Alteration in sweating. In heat stroke brought on by hot weather, your skin will feel hot and dry to the touch. However, in heat stroke brought on by strenuous exercise, your skin may feel dry or slightly moist. Nausea and vomiting. You may feel sick to your stomach or vomit. Flushed skin. Your skin may turn red as your body temperature increases. Rapid breathing. Your breathing may become rapid and shallow. Racing heart rate. Your pulse may significantly increase because heat stress places a tremendous burden on your heart to help cool your body. Headache. Your head may throb. Heat stroke requires immediate medical treatment. If you're waiting for an ambulance to arrive, try to cool the victim as much as possible by applying ice packs to the neck, groin, and armpits. Encouraging your kid to drink slightly salted fluids, such as sports drinks or salted water. Having your kid lay down in a cool, shady, well-ventilated environment. Immersing your kid in cool water, if possible. Misting your kid with water and blowing air across their bodies. Evaporative cooling. Monitoring your kid's breathing carefully and removing any airway blockages. Removing any clothing that is tight or heavy. At the hospital, a kid with heat stroke may receive cooled intravenous fluids through a vein in their arm, cooling blanket, ice bath, medication to prevent seizures, supplemental oxygen. Thank you for watching that interesting and educative video. Kindly hit the subscribe button to subscribe to our YouTube channel, and you'll be first to get notified when we drop a new video. See you next time.